Thanks so much, Dr. Zhao, and my thanks go as well to the Workshop Planning Committee. We've done a lot of work in a relatively short period of time, and I appreciate their volunteerism, along with the speakers who are with us today, the facilitators, the rapporteurs who have volunteered to help us, and then, of course, also to all of you for being in attendance, both in person here at the auditorium at the National Academies, but also online. You will contribute in many important ways to this discussion, and I appreciate that. So the workshop format, the purpose is to foster dialogue and to bring forth ideas about research priorities, but of course not to provide a recommendation. We do believe that it's possible to help to foster research during a response to inform practice, and also to ensure that guidance in the future is based on the most current and best available science, and to make sure that data are gathered before they're lost. The research ideas identified will help inform public health guidance and clinical care guidelines, but we're not here to review those or to participate in developing them. So the outline for the day is that we will begin with some plenary talks that will help us to come to a common understanding about some of the research and initiatives that are already established in this area, as well as understanding some of the potential gaps that exist. Then we will split into 4 breakout areas, one on transmission routes and routes of entry and exit for the Ebola virus, a second on survival and infectivity of the Ebola virus in the environment, a third on personal protective equipment and personal protective behaviors to prevent transmission and reduce exposure to Ebola virus, and the fourth about the handling of potentially Ebola virus contaminated materials, waste, and disinfection. So we know from a lot of data that healthcare workers are at risk, and this just shows the epidemic transmission diagram from the cases that occurred earlier this year in Nigeria. And what I wanted you to key in on this slide are the blue squares are healthcare workers. And responders of all kind, whether they're healthcare workers or family care providers, have been particularly at risk for acquiring this disease, so that we know that the workforce is at risk. When we think about risks like this in the context of protecting workers, we're thinking about exposure, and our concept of exposure has to do with the contact between the outer boundary of the human body and a pollutant or a mixture of pollutants, or in this case, a virus such as Ebola virus. And so that, of course, requires the presence of the pollutant and actual contact with it, and usually a quantification of the amount of the pollutant and the time of contact. This is kind of formally how this is normally done. So the whole paradigm for environmental health has to do with looking at agents such as the Ebola virus, vectors for those agents such as either biological fluids or perhaps animal reservoirs or hosts for a virus, exposure routes, perhaps dermal, oral, IV, in the case of needle sticks, or respiratory perhaps, and biological responses such as infection, disease, death, or just immune responses to that infection. So within that framework, of course, the primary concern always is what is the agent, and we're going to learn more later today about this agent, the Ebola virus, an RNA virus that's very interesting and obviously a very dangerous agent. And when we think about how people might have contact with it, what kind of symptoms occur in an epidemic are certainly important to understand. And this is from the epidemic in Sierra Leone, a recent paper in the New England Journal of Medicine that simply documents that a fair proportion of the cases have diarrhea and vomiting, and a smaller proportion cough. And so these are 3 ways that bodily fluids are certainly going to potentially be involved with caregivers. Animal hosts and vectors are another question that need to be considered, and we certainly know in the situation in Africa that there are animal hosts that are involved, and we don't know a lot about exactly how those dynamics work in the ecology of this disease, but we don't know if there are potential risks with companion animals. And so there's been a little bit of a question about what to do with companion animals, and this is simply a picture of one of the nurses who was treated, Nancy Pham, with her dog Bentley, both of whom were sent home on Friday, one after being treated and the other one, the dog, after being quarantined for 21 days. So there are basic strategies in public health that we use to prevent injury, to prevent people from receiving harm in the environment, and ranging from, of course, trying not to create the hazard in the first place, or reducing or preventing or modifying release of the hazard, all the way to some of the things that could be done in the future, like increasing resistance, and improving emergency response, and improving care and rehabilitation. But here we're really focused on these three things in the middle ground: separating in time and space, separating with a physical barrier, and modifying surfaces and basic structures, finding ways to separate people who might be at risk from the hazard. And particularly, I think that we're most concerned about, again, responders, care providers of all kinds, whether occupationally involved in providing care or as family members. And when we think about occupational exposures and potential interventions that we can use to eliminate or reduce exposures, we think about these as occurring on a hierarchy, where we know that it's far more efficacious if we can engineer the environment or change processes to prevent the possibility of exposure in the first place. Less effective is to take administrative or programmatic or behavioral approaches, where we try to change the way that people work together, the behaviors around cases. And least efficacious, actually, the use of personal protective equipment. And so PPE, personal protective equipment, is really considered to be a last resort, but something that is very, very necessary if there is no way to protect people through engineering or administrative approaches. And indeed, we have a lot of information about PPE. There are existing criteria. We're not here to review these, but just to remind you that we're not starting from ground zero. These are the protocols that Emory University, Emory Healthcare currently has on their website, which are labeled draft, which I think means that even for Emory, which is very experienced with treating these kinds of illnesses, that this is an evolving process learning. We currently also have waste management protocols. The OSHA has bloodborne pathogens guidance. The U.S. Department of Transportation has many regulations, and there's an enormous patchwork of state and local regulations about the management and handling of biohazardous waste. And so at the same time, we know that the few cases that we've had in the United States have posed immense challenges just in terms of the quantities of waste that have been generated. And for example, in New York, with one case that an entire truck pulled up at the apartment to haul off waste, and that in Dallas, with one patient, 140 barrels, 55-gallon barrels were generated from a single apartment. And that, in fact, there are controversies about how the ashes from incinerating that waste will be handled, with states competing not to take those ashes. So we will produce a workshop report that will be prepared by the Institute of Medicine. This will be publicly available and will reflect what has transpired here at the workshop. There won't be further deliberations by our planning committee. What will be in the report will emerge from what the speakers at the workshop bring forward, but also what the breakout groups bring forward. It will be published by the National Academies Press. The views and ideas will be those of the workshop participants and not the National Academy of Sciences or the Planning Committee. And there will be no formal consensus findings and recommendations coming from this activity. So with that, and to conclude once again by thanking you all for being here, I would now like to turn to Dr. Nicole Lurie. She is the Assistant Secretary for Preparedness and Emergency Response at the Department of Health and Human Services, and she will give you a perspective from the standpoint of her agency for this workshop. Thank you, Nikki, for being here.